Many people take over-the-counter sleep aids for difficulty sleeping. There are dozens of over-the-counter sleep aids on the market. In this video, I will briefly discuss common over-the-counter medications for insomnia. About one-third of adults in the United States report symptoms of insomnia in a given year. People with insomnia can have difficulty falling asleep and/or staying asleep. Some people may wake up too early and do not feel rested in the morning. Insomnia can have negative impact on people's life. For example, insomnia can cause daytime fatigue, daytime sleepiness, irritability, depression, anxiety, lack of concentration and focus, impaired memory, increased risk for accidents, overall poor quality of life, etc. There is a variety of over-the-counter medications for insomnia. For example, Unison, ZQuil, Nytol, Tylenol PM, Aleve PM, Advil PM are commonly seen on the shelf. Other sleep aids are also available under the brand name of Kirkland, CVS, Walgreens, Rite Aid, Equate, etc. These medications are formulated as tablets, soft gels, liquids, or chewable tablets. Some sleeping medications contain pain relievers such as Tylenol or acetaminophen, Aleve, Advil, or Motrin. Regardless of the names and formulations of the sleeping medications, the active ingredient of the medications is either doxylamine or diphenhydramine. Diphenhydramine is the active ingredient of Benadryl, which is commonly used for allergy relief. Doxylamine is indicated for adult and children 12 years and older. Diphenhydramine should be avoided in children under 6 years of age unless instructed by a healthcare provider. The dosage of doxylamine is 25 mg a day. The dosage of diphenhydramine is 25 to 50 mg a day. Both medications should be taken 30 minutes before bedtime for insomnia. Both doxylamine and diphenhydramine are first-generation antihistamines. They can cross the blood-brain barrier and have anticholinergic activity. Therefore, they can cause significant side effects. The side effects include the next-day drowsiness, constipation, dizziness, difficulty urinating, blurry vision, confusion, etc. Alcohol should be avoided when taking these medications because alcohol can aggravate the side effects of the medications. In addition, do not combine over-the-counter sleep drugs with other medications that contain first-generation antihistamines such as Benadryl. Long-term use of diphenhydramine or Benadryl has been associated with an increased risk of dementia. Because both doxylamine and diphenhydramine can have significant interactions with other drugs, it is important to inform your healthcare providers if you take any of the sleeping medications. Although many people take over-the-counter sleeping medications, there is limited evidence that these medications are effective for insomnia relief, and there are known risks associated with these medications. For this reason, the American Academy of Sleep Medicine does not recommend the use of diphenhydramine for insomnia. Similarly, doxylamine is not recommended for insomnia treatment either. The American Geriatrics Society also advises against the use of these over-the-counter sleep medications in people 65 years and older because of risks such as confusion, constipation, dry mouth, and cognitive decline. Other over-the-counter sleep aids such as melatonin, tryptophan, and valerian are also available. They are classified by the FDA as dietary supplements rather than drugs. Although some people feel that these supplements do help them sleep better, the American Academy of Sleep Medicine does not recommend the use of melatonin, tryptophan, or valerian as a treatment for insomnia in adults. Instead, cognitive behavioral therapy for insomnia provided by a counselor or a psychotherapist is recommended as a first-line treatment for insomnia. Over-the-counter sleeping medications may be used only occasionally as adjunct treatment. If you have to take an over-the-counter sleeping medication, you should use it for no more than 2 weeks.